Hello and welcome to this special edition of the PJ Pod, brought to you by the Pharmaceutical Journal, the Royal Pharmaceutical Society's official journal.
Here we are once again for a look back at the year gone by in pharmacy with the Pharmaceutical Journal team. We'll recap some of 2024's biggest news stories before we jump ahead and make a few predictions for the new year. I'm Carolyn Wickware, Executive Editor at the Pharmaceutical Journal, and this year I'm joined by familiar voices that you'll have heard on the podcast. I'll introduce everyone as we go along, but in the meantime, hey everyone.
Hey. Hello.
Hey.
Hello.
We do, however, have one fresh face on the team, our investigations editor, Sophie Willis. To put her out of her misery, we'll hear from Sophie first. Hi, Sophie.
Hello.
So, this year, we finally saw the launch of Pharmacy First, the long-awaited minor ailment service in pharmacies in England.
Yep, that's right. The service launched on 31st of January, covering 7 common conditions: sinusitis, sore throat, infected insect bites, impetigo, shingles, uncomplicated urinary tract infections in women, and acute otitis media.
And how's the service going?
Well, we looked at claims data for the first 5 months of the service, and it showed that there's huge regional variation in the volume of consultations conducted. Pharmacies and some integrated care boards, or ICBs, are claiming for almost 10 times as many consultations as those in others.
Okay, now just a second, Sophie, because we have Dawn here too. Dawn, as our senior features editor, you produced an in-depth infographic on this. What else did you find out?
Yeah, that's right, I did. And my analysis also showed that pharmacies had missed out on £13.2 million of funding during the first 5 months, either because they'd not made any claims for Pharmacy First consultations, or they'd not reached the threshold that triggers a monthly fixed payment, which I'm sure Sophie can tell you a bit more about.
Right, okay, Sophie, so the thresholds seem to be ever-changing.
They are. Ever since the service first launched, pharmacy leaders have criticised the monthly thresholds, which mean that pharmacies need to hit a certain number of consultations before they can receive a fixed monthly payment of £1,000 on top of the £15 they get for each consultation. The threshold was originally set at 1 consultation in February, the first month of the service, and continued rising every couple of months before it was set to increase to 20 consultations in August. But Community Pharmacy England warned in July that pharmacy owners were concerned about the thresholds, and it announced that the Department of Health and Social Care had agreed that the threshold would only be increased to 15 consultations in August instead.
So some concessions were made.
Yes, but wait, the threshold increased to 20 consultations in September, and they're set to increase again from next year.
All right, so Pharmacy First is underway in England. The other service we've been waiting a long time for now is the Independent Prescribing Pathfinder service. This is what will give pharmacists significant autonomy in their provision of medicines to patients. How's that service moving along?
Very slowly. The service was originally supposed to start in January 2023 in 210 pharmacies across the country, but what we saw this year instead was a rollout of the service in just 14 pharmacies in May as a proof of concept. And in August, NHS England announced that the IT system was ready to go in all Pathfinder sites. In December, it was announced that Well Pharmacy in Keighley, West Yorkshire, has become the first community pharmacy site to go live using the dedicated IT system.
And this service is largely the result of wider plans for all pharmacists to become independent prescribers from the point of registration in 2026, so that pharmacists in the community will have a service through which to use their hard-earned skills.
Yes, although that's not going smoothly either.
Oh, okay.
These changes to initial education and training mean all trainees from next year's cohort require a designated prescribing practitioner, or DPP, to supervise them during their prescribing training. But pharmacy leaders have been warning all year of shortages in the number of DPPs, and the situation doesn't seem to have improved. Our annual salary and job satisfaction survey revealed that only 16% of pharmacists undertook DPP training in the past year, and a survey conducted by the Black Country Integrated Care Board revealed that more than half of sites in the area don't have a DPP in place for the 2025-2026 Pharmacist Trainee Foundation year.
That must be putting students in quite a bind.
Yeah, and they're facing a whole set of other concerns as well. I exclusively revealed in August that of more than 4,000 students who began the first year of their MPharm in 2021, roughly 900 students had dropped out before they started their second year, a significant increase on the roughly 600 students who withdrew the year before.
That's a huge increase on the number of MPharm dropouts. What prompted that?
I did a little investigating and found that it was because of a combination of factors, including the impact of the COVID-19 pandemic, the rigorous nature of the MPharm course, and increasing levels of mental health conditions. Some of the pharmacy schools told me what they were doing to combat this. For example, the University of Brighton said it had put in place measures such as a member of MPALM staff responsible for overseeing the academic progress of part-time students, while the University of East Anglia said it has invested more resource into earlier intervention by ensuring student advisors are proactively contacting students who may be struggling.
Now, it wouldn't be an end-of-year podcast if I didn't ask about the state of pharmacy closures. What's the latest on that?
It's still a big concern for community pharmacy. Funding pressures have continued into 2024, which means so have closures. And as we're still waiting for the new community pharmacy contractual framework, it remains to be seen whether pharmacies will be offered any relief.
Is there any hope you can offer our listeners when it comes to 2025? What are your predictions?
I'm going to find it hard to answer that one. Legislation to allow hub-and-spoke dispensing, where a pharmacy can outsource dispensing to a third party, was meant to come into effect from 1st of January 2025. However, the DHSC said in September that, after the general election, new ministers were being briefed on all policy areas, including hub-and-spoke dispensing, meaning implementation of the proposals would be delayed. When that does come through, though, it should really help give pharmacists more time to spend on other activities, like clinical services, which bring in more money. I'll take a risk and say this will be in place by the end of next year, even if it doesn't seem to be a priority.
All right, thanks, Sophie. Great debut on the PJ Pod. Now, Sophie, you mentioned there the contract. As ever, there's a lot riding on the new pharmacy contract being agreed as soon as possible. As it stands at the moment, pharmacists are really burning the candle at both ends. Dawn led on our annual salary and job satisfaction survey this year, which showed persistently high levels of stress among pharmacists. Hi again, Dawn. Can you tell us a bit more about what the survey found?
Yeah, sure. Hi, Carolyn. So we had about 1,400 practicing pharmacists respond to our survey in April this year, and we found that 1 in 4 reported feeling very stressed at work. This is approximately the same proportion as 18 months into the COVID pandemic in September 2021, and double that in the previous 3 years.
Wow. Well, I could probably take an educated guess at what's causing these high stress levels. But what did you find out from the survey?
Yeah, the stresses varied according to what sector the pharmacist worked in. For community pharmacists, it's a chronic lack of funding, which has left many businesses running at a loss or having to reduce their hours, with some closing completely. For hospital pharmacists, the stresses were around workforce, with recruitment challenges and NHS industrial action contributing to these. And in primary care, financial struggles within general practice, compounded by challenges with GP recruitment and a continued increase in demand for appointments, has piled pressure on the sector.
It makes sense that the stressors would vary by sector, I guess. What other insights about working in pharmacy did you get?
There was also our findings on the ethnicity pay gap. Me and Corrinne wrote a feature on this earlier in the year.
Yes, PJ reporter Corrinne Burns. She's here now and I'll bring her in. Can you tell us more about the ethnicity pay gap at the moment?
Yeah, so unfortunately, we saw from the survey that the ethnicity pay gap seems to persist. This year, the data we collected showed an overall median pay gap of 7.2% between white pharmacists and those from ethnic minority backgrounds. Now, that was based on responses from around 1,200 UK-based pharmacists. And it works out at around an additional £4,000 per year in cash terms for white pharmacists based on a 37.5-hour week.
How does that pay gap compare to the last time we carried out this analysis?
Well, back in 2021, we reported a median pay gap of 7.3% overall, so not much change there, unfortunately.
Right, okay. So what's being done now to promote equitable pay in the profession?
Well, the Royal Pharmaceutical Society, the RPS, have their inclusion and diversity strategy that aims to champion inclusive leadership practices. Now, that says, accurately, that the lack of racial diversity at senior levels in pharmacy isn't fair, and it's a waste of talent. There's also the Inclusive Pharmacy Practice Initiative, which has been going since 2017, and that led to the Pharmacy Workforce Race Equality Standard, which is a report into race equality in NHS-employed pharmacy teams. Also, Labour did commit to introducing mandatory ethnicity pay gap reporting for large employers as part of its election manifesto, which I suppose would apply to a lot of the big pharmacy multiples. And that was confirmed in the King's Speech when it announced a draft Equality, Race and Disability Bill, which will mandate reporting for large employers. So let's see what happens.
Thanks, Corrinne. Yeah, hopefully we'll finally see some progress on that.
Yes, hopefully. Thanks, Corrinne. Dawn, I wanted to talk to you about drug-related deaths. You've covered that quite extensively this year, and they've been some of our most well-read stories on the site. What did you find out?
Yeah, sorry, Carolyn, I've got no positive news for you here, but we reported this year that drug-related deaths in Scotland rose by 10% in 2023, following a downward trend in the previous 2 years. Now, experts put the increase down to the emergence of new powerful synthetic opioids called nitazines. While these used to be linked to contaminated batches of heroin, they're increasingly being found in counterfeit medicines, including benzodiazepines and oxycodone. Another drug called xylazine, otherwise known as the zombie drug, a high-strength veterinary sedative implicated in a growing number of drug deaths, has also been found in counterfeit medicines. So the worry is that many users will be unaware that they're taking these really dangerous drugs.
What's the government doing about that?
Well, the Home Office has banned 14 nitazines so far, and it's introducing into law a new generic definition of nitazines, which will prevent drug gangs from attempting to use minor adjustments to their synthetic compound to try to bypass UK drug laws. The changes are expected to come into force soon. And it's also making xylazine a Class C drug, which means that anyone caught producing or supplying it faces an unlimited fine and a prison sentence. But experts say that banning these substances may not help, and that harm reduction strategies, including safe drug consumption rooms, need to be stepped up.
Okay, you mentioned safe drug consumption rooms. Wasn't the UK's first facility set to open in Scotland this year? Did that happen?
Not yet, but watch this space. After many years of campaigning, a safe drug consumption room was due to open in Glasgow in October, but unfortunately this was pushed back while checks were carried out on the building.
So do you think that a 2025 opening would be a pretty safe prediction?
Yeah, I'd say so. I mean, maybe even December 2024, but we just have to wait and see. I think the problems were down to building work rather than any difficulties with the facility itself going ahead.
And is that it for drug deaths?
Sadly not. So those were the illegal drugs, but we've also been looking at pregabalin prescribing. That's a prescription medicine that hit the headlines in March this year when the Sunday Times reported that it had the fastest rising death toll of any drug in the UK.
Just remind us what pregabalin actually is.
So it's a medicine that's used to treat neuropathic pain, seizures and anxiety. It was made a Class C drug back in 2019 after it was linked to an increase in drug deaths. But what we learned from a Freedom of Information request was that the number of patients prescribed pregabalin in primary care in England has increased since prescribing restrictions were imposed.
Okay, and did the experts you spoke to say what pharmacists can do to help address these deaths?
Yeah, the main thing is to ensure that pregabalin is being prescribed appropriately. So pharmacists in general practice should be reviewing patients taking pregabalin, and community pharmacists should be prompting people to get their medicines reviewed, as well as highlighting the potential dangers of combining pregabalin with opioids. It's obviously also important that people aren't able to get hold of these prescriptions without the proper checks and balances in place. And the General Pharmaceutical Council has been looking closely at regulation of online pharmacies this year.
All right, okay, just one more topic that I wanted to ask you about. Another area you've been working on this year is the rise of certain infectious diseases and the evolution of vaccination programs to help tackle this. Can you tell us a bit about the developments in this area?
Yep, just to carry on the cherry theme that we've had so far, there have been quite a few outbreaks this year. Obviously, COVID and flu are rumbling on in the background, but we've also had a peak year for measles, which has been fueled by a drop in vaccination rates. As a result, some community pharmacies in northwest England have been taking part in a pilot programme to offer MMR vaccination to children and young people who've missed one or both doses. NHS England also commissioned pharmacies in the east of England to provide RSV vaccines from September 2024 as part of a wider vaccination programme after the first vaccine for older adults was approved in the UK in July 2023. And it got off to a really good start. Over 8,000 vaccinations were administered during the first 2 months of the service. And a vaccination programme for Mpox was also announced this year in preparation for UK cases of a new clade of the virus, which is spreading rapidly in Africa. It's unclear yet as to whether pharmacists will be involved in that particular programme, though.
Right, so measles, RSV, Mpox. That's quite a few outbreaks.
Yeah, there is actually one more. We also saw an outbreak of whooping cough this year, with more than 10,000 cases reported in the first 6 months of the year, and that exceeded the total number of cases in 2012, which was the last major outbreak of the disease. Again, this is owing to a drop in vaccination rates that's been ongoing since 2018. At this point, pharmacists aren't involved in the whooping cough vaccination programme, but pharmacy organisations say that pharmacists could provide a wider range of vaccinations in any overhauled NHS vaccination service. When ICBs are given more responsibility next year, that will allow them to design a local vaccination delivery network that meets the needs of their population. So we might see more pharmacy involvement then.
That sounds like another prediction to me.
Yes, I guess it could be.
All right. Okay. Thanks, Dawn. Now, Corrinne, thanks again for your recap earlier on the ethnicity pay gap data. I did just want to touch on a couple of other important areas that you've had your eye on this year. The first is the big news from the Royal Pharmaceutical Society.
Yes, I might be able to lighten the tone of the podcast up a bit here because a lot of people we spoke to saw this as potentially exciting. Big news from the RPS in September. They're proposing to members that the society moves to become a Royal College and a registered charity.
Indeed, and we are dedicating a whole podcast episode to this topic. But just briefly for listeners here, why has the RPS decided to make these proposals now?
Well, when I spoke to Paul Bennett, now he's the chief exec of the RPS, he said that back in 2020, the RPS Assembly considered the possibility when it was making its strategic objectives. He said the idea wasn't ruled out, but given everything else at the time, and remember 2020, that was at the time of the pandemic, there were lots of other things to focus on. And he said, over the last 4 years, the society has learned and done a lot, and they now believe it's the right time to put the idea out there.
And when will the final decision be made?
Well, the final decision is down to the members. We expect a vote sometime in March next year. Now, you and I, of course, attended a couple of those roadshows that the RPS arranged, where they put their ideas to membership and gathered feedback, as well as responding to questions.
Yeah, we did. What did you think of the roadshows?
The Q&A sessions were really lively. It was clear, I think, that people feel a good sense of belonging to the society and they're invested in the outcome. I definitely got the sense that most people supported the idea. But anyway, do check out Paul's interview with us and the RPS's FAQs on their website and our podcast, of course.
Yes, good plugs. We'll include links to those articles and many of the other articles we mentioned today in our show notes for this episode. I also wanted to pick up on the new legislation around the pharmacy technician role. What's happening there?
Yes. In June this year, legislation came into force allowing pharmacy technicians to administer certain medicines under a patient group direction. Now, those allow the supply of specific prescription medicines under defined circumstances. The legislative change followed a DHSC consultation, and in that consultation, most people who responded agreed with those proposals. And it's not the first time pharmacy technicians have been able to do things like this. During the pandemic, they administered COVID vaccines under a national protocol issued by the government.
Yeah, they did. So why is this happening now?
Well, speaking to the PJ ahead of the changes, the then pharmacy minister, Andrea Leadsom, said the legislation would enable better patient access, whilst at the same time ensuring absolute patient safety. And the Association of Pharmacy Technicians UK said they were excited by the changes and thought it signified greater recognition of the value of pharmacy technicians. They did say, though, that it would be a challenge to make sure that they get protected time for the necessary training.
All right, before you go, any predictions for next year?
I'm not sure it's a prediction, but it's certainly something to keep an eye on. Both Holyrood and Westminster are considering assisted dying bills. although there are some differences between the two. At the time of recording, the Scottish bill is at stage 1. In Westminster, they've just had the second reading and MPs voted in favour of it. But there's a long way to go yet. To be honest, I can't predict what the final bills will look like. It's an emotive and a complex area. The RPS has a neutral stance, but has said that pharmacists should be able to actively opt in rather than have to opt out.
It is a very complex area that I'm sure we'll be covering in more depth in the new year. Thanks, Corrinne. Now over to David Lipanovic, our senior clinical reporter. You've been looking at medicine shortages quite a bit this year. It's been an ongoing issue for the past few years, but what's new for 2024?
Yeah, hi Carolyn. So once again, medicine shortages have been a major topic of concern in 2024. According to a survey conducted by Community Pharmacy England in May this year, 90% of pharmacies reported that shortages have gotten worse compared to 2023. A survey conducted by the PJ around the same time also found that 70% of pharmacists have said medicine shortages have put their patients at risk, particularly in relation to ADHD medicines, anti-epileptics, pancreatic enzyme replacement therapy or PERT, and medicine to treat diabetes including insulin and GLP-1 receptor agonists.
So why are these shortages happening?
Yeah, it's a good question. There are several factors that contribute to these shortages, but the main cause is the significant increase in demand for these medicines. For example, in ADHD, the number of patients that require treatment has increased dramatically in recent years, which led to the initial shortage back in 2022 and has been ongoing since. While Takeda, one of the main manufacturers of ADHD medicines, confirmed in May that most of its products are available, which is positive news, patients are still reporting difficulties accessing both ADHD medicines and diagnostic services. Patients are also being severely impacted by shortages of Creon, by far the most commonly prescribed PERT for people with pancreatic insufficiency such as pancreatic cancer and cystic fibrosis.
That does sound very concerning. What's behind the Creon shortage?
It is quite concerning. So the Creon shortage is quite unique. Creon is produced from pancreatic enzymes sourced from pigs because they have the closest functions to human pancreatic enzymes. But since the 90s, there's been a big shift in the way the pork industry raises and processes pigs to meet consumers' demand for leaner cuts of meat. And in a sort of a weird knock-on effect, this global push for leaner pigs has resulted in fewer available enzymes, making it harder for manufacturers to maintain production to meet the growing demand for PERT. And because Creon dominates such a big proportion of the market, this has had significant effects on the two remaining brands of PERT in the UK, Nutrizam and Pancrex.
How has this affected patients?
Massively. This is obviously having a huge impact on patients who need these medicines to digest food. Some have even reported losing weight because they haven't been able to fill their PERT prescriptions. In the meantime, charities have produced guidance for patients and clinicians to help reduce the impact of the shortage. But it is a bit of a waiting game at the moment. The government has said that they are working with suppliers to manage the shortage, but the supply issues aren't expected to resolve until 2026.
What about GLP-1 receptor agonists? They've been very popular, but that's another significant shortage this year. What's the latest on them?
Well, the initial national shortage of GLP-1 receptor agonists was announced back in June last year and was expected to last until the end of this year. While there are still intermittent supply issues with Ozempic, the injectable semaglutide, which is expected to run into 2025, there is now a good supply of oral semaglutide and Mounjaro, the injectable tirzepatide. So it does appear that supply issues are improving for these medicines.
That's good to hear. There have also been a lot of safety concerns about these medicines. Can you tell us a bit more about that?
In August, the MHRA said they had received 46 reports of hospitalizations associated with GLP-1 receptor agonists. Now, there are two parts to this. The first is the clinical concern, particularly around gastrointestinal side effects, which are commonly reported with GLP-1 receptor agonists. According to the August report, there were over 5,000 reports of gastrointestinal reactions, including nausea, vomiting, and diarrhea associated with the drug class. Second is around the hospitalizations caused by counterfeits brought online. In a small number of cases, the MHRA have found falsified pens containing insulin instead of semaglutide, which has even caused some patients to go into hypoglycemic shock and coma.
Right, okay, those are pretty serious cases. Sounds like there's still a fair bit we are learning about GLP-1RAs. Moving on to some other big topics, there have been several decisions from NICE which have made the headlines this year. Which of these would you say is the most significant?
It's a tough one. There's been so many, it's been hard to keep up with any of them. But one that springs to mind was in August and October this year, NICE decided against recommending lecanemab and donanemab for the treatment of Alzheimer's disease despite their effectiveness. And that was mainly down to cost. NICE said while the drugs have been shown to slow progression of Alzheimer's disease by between 4 and 6 months, the costs of delivering the drug and monitoring for side effects combined with the, quote, relatively small benefits, end quote, meant that it wasn't considered a cost-effective use of limited NHS funding. At present, NICE guidance for both of those drugs are in their draft form, so the committee could still change their decision depending on responses to the consultations. A final decision on lecanemab is due in February and donanemab in March next year. So I guess that is quite unfortunate, but even though they're not yet available through the NHS, the fact that there are drugs being developed is a good sign.
Yes, continued drug research and development is definitely needed here. On to your 2025 predictions, Dave. What do you have for us?
Well, before I get to that, let me first point out that my prediction for this year was bang on with more options of smoking cessation drugs in the UK, which did happen, and which I was very happy about. But I really hope that my prediction for next year is incorrect. So for 2025, I predict that families with patients who were affected by sodium valproate exposure in the womb will still be waiting on their compensation.
Oh no, why do you think that? Weren't you at the House of Commons when the Patient Safety Commissioner recommended the redress scheme earlier this year?
Yes, I was, and while the proposed redress scheme is excellent progress, the government has previously rejected recommendations for such a scheme. And I just don't think anyone in the government is exactly putting their hand up to pay millions of pounds for compensation right now. I really hope I'm wrong about this though, because these families have been through enormous amounts of physical, mental and emotional distress and absolutely deserve to be compensated.
Okay, let's move on to a more positive, optimistic note to finish up. Caitlin Killen, our clinical editor, is on hand to talk to us about developments in research over the past year. Hi, Caitlin.
Hello, yes, I'm hoping I can help us end on a high.
Yes, I hope so. So tell us what caught the attention of the research and learning team this past year.
Well, before I get into that, there are a couple of points I wanted to pick up on from earlier in the podcast.
Yeah, go for it.
Dawn mentioned a rise in whooping cough and RSV cases. One way pharmacists can help tackle these outbreaks is by promoting maternal vaccination. As part of the RSV programme, pregnant patients are routinely offered the RSV vaccine from 28 weeks. It's estimated that this will prevent 5,000 infant RSV-related hospitalisations and 200 infant intensive care admissions annually. We've recently published a learning article on the role of pharmacists in promoting maternal vaccination.
That's really helpful. Thank you. We'll include a link to that and our other vaccine-related resources in the show notes.
Perfect, thank you. The other thing to say is that as we get closer to the initial education and training changes in 2026 that Sophie was talking about, the learning team has continued to expand our content to support independent prescribers, including the development of a new article format, the Prescribing Dilemma series. These draw on real-life scenarios of grey areas in prescribing, and each article explores how an experienced pharmacist prescriber approached the situation, worked through options, and used their clinical judgment to reach an appropriate outcome.
Great, thank you. We'll include the most recent one in our show notes as well. Lots going on in those show notes, so don't miss them. What have been the topics of greatest interest in terms of research this year?
This year, particularly for the PJ Pod, we've focused on the involvement of pharmacists in emerging therapies. We wanted to highlight patient voices and learn about their lived experiences. It's really made it clear the positive impact these therapies can have on patients, but also the challenges involved. The episode on how pharmacists can support patients with chronic lymphocytic leukemia, or CLL, was really brought to life by a candid interview with Anthea Holland, who's lived with CLL for over 17 years. She's been through loads of different treatments over the years and is now benefiting from cutting-edge treatments like the recently approved second-generation BTK inhibitor, zanubrutinib, which she felt really fortunate for.
That's great that you were able to capture that patient perspective. That was a great listen. And if anyone wants to go and find that episode on Spotify, it went out in September. What else?
We also did an episode on new therapies to treat migraines. For example, rimegepant, which is a calcitonin gene-related peptide receptor antagonist that works by inhibiting the function of CGRP, thereby preventing migraine attacks. It was approved by NICE in September 2023. Again, the episode benefited massively from hearing about the lived experience of a patient. We spoke to Kerry Spalding, who's been experiencing migraines for more than 30 years. She told us that she takes triptans to manage her migraines, which can only be used for 10 days out of a month because they cause medication overuse headaches. This potentially leaves Kerry unable to use her medication once she has gone over the 10-day threshold. The newer treatments like rimegepant don't have this issue and can be used as needed. Unfortunately, Kerry told us she isn't currently eligible to receive rimegepant, but her experience highlights the potential role of pharmacists in helping patients like her access these therapies, and also how to support patients who may not yet be eligible to continue managing their conditions.
Right, that really shows the importance of having pharmacists involved in research, both for the good of the patient and for the advancement of the profession.
Yeah, that's right. And actually, supporting pharmacists who are interested in getting into research has been a priority for the Research and Learning team this year. In 2024, we announced our second winner for the Outstanding Pharmacy Early Career Researcher Award, or OPRA. This is an award from the Royal Pharmaceutical Society that recognises researchers in the early stages of their career who are making significant contributions to advanced research across any aspect of pharmacy practice or pharmaceutical sciences. Sean Scott was our winner this year. He's a lecturer in behavioural medicine at the University of Leicester, where he uses his expertise as both a pharmacist and a behavioural scientist to understand the behaviour changes needed for routine proactive deprescribing to be integrated into clinical practice.
He sounds like a very worthy winner. Are we doing this again next year?
Yes, so nominations for Opera 2025 are now open. So if this sounds like you or someone you know, we want to hear from you. A link to the nomination form will be in the show notes.
Yes, please do get your nominations in. The closing date, I believe, is the 31st of January, 2025.
Yes, that's right.
Thanks for that update, Caitlin. Do you have any predictions for next year? What will the learning team be focusing on?
So my prediction is the continued development of digital tools and the use of things like AI to streamline patient services. So the learning team will be working on some resources to support pharmacists in these areas.
AI, that's very topical. Definitely sounds like something to keep an eye out for. Thank you, Caitlin. I think that concludes our recap of 2024. Thank you to the whole PJ team for producing some fantastic journalism this year. It's been a great year for the PJ Pod. Let's not forget that we won Best B2B Podcast at this year's British Society of Magazine Editors Talent Awards in June. Hopefully more of that success to come in 2025. Of course, we couldn't do it without the wonderful experts who've given their time to come on the pod this year, and our loyal listeners who like, subscribe, or follow us. Thank you all. We've made our predictions for pharmacy in 2025, but please do let us know what we've missed. You can let us know on social media using the hashtag PJPod or email us at editor@pharmaceutical-journal.com. This episode is part of our December issue. Just before I let you go, if you're interested in joining the RPS to access a range of member benefits, including the pharmaceutical journals, news, features, and learning resources, you can do so for the equivalent of just 60p a day. Just search RPS membership to find out more. Thanks for listening. Bye for now.
Bye.
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 Bye.